Okay, this is our first introductory video to using NextGen EHR for clinical use at Liberty Clinic and the other supported clinics through the Liberty Hospital Corporation. This first video is just going to give you a little bit of a tour of the layout and get you familiar with the basics of how to use NextGen. So first of all, I'm going to go over the basic toolbars here. You'll see on the top, as in most Windows programs, you have several options. If you click on these, they'll drop down and there will be multiple options to choose from. Most of the time, you're not going to use this region to do much. The only ones I'll point out here would be under File. You can find Patient Education. If you click on that, you'll find libraries of patient education. If you click on Adult Health Advisor, for example, you can search for different items such as hypertension, and you can display it if you've picked a patient, or in this case, if you picked an item here like DASH diet, and then you can print this out for patients to take home. Other than that, there's not a lot that you can use on this top menu. Most of what you'll see here is included elsewhere, so we'll go over that at that time. Second, below here you'll see a line of icons. Yours may be smaller than this. You can change the size of the icons later on, and I'll show you how to do that. And also you can customize which icons you'd like displayed and in what order. So first I'm going to show you these icons here. This is the log out button. If this is a one-click button to log out of the system. This is the save button. This is grayed out right now because a document's not able to be saved, but once it is, it'll turn blue like the like that right there. Okay. This is the clinic location. You can select from multiple clinic locations in the enterprise, and you'll want to make sure that you're properly displaying the location you're working at for that day. This is the provider. So if you select this button, you can pick any of our providers. It's linked to the location. So if I switched to Excelsior Springs Clinic, you should have some Excelsior Springs options, but right now that's not listed. But anyway, that's what's going to allow you to pick your provider. Next, you'll see this is a patient lookup button. You'll be able to search by any of these fields. You don't have to fill all of them out. You can fill out one or several, and you don't have to completely fill out the information. For example, if I'm looking for ZZ Anson, we'll just type ZZA, and it'll pull up anything with that in the list, and you can pick what you want. Next, you'll see the patient history window. This is an important one. When you click on this, it's like opening the patient chart. If we select a patient, for example, you'll see here that you now have the patient history window, and we'll go over that briefly here. So you have three different toggles you can go back and forth with. On the left, you'll see the patient history window. This is a chronological account of all patient encounters. Next, you'll see patient demographics, and in this window you'll see some different templates. We don't often use that, but that's where that is located. And then in categories, encounters and different documents are listed by category. And in this patient, since it's a fake patient, you'll not see a lot there, but later on you'll be able to search for things by category, so keep that in mind. Next, you'll see the inbox icon. This will pull up your inbox, which we'll go over in another video. Shows you how to get there. You can toggle this on and off. The next is the PA queue, or provider approval queue. This is probably not going to be useful for clinical staff, but for providers, you can click that to get into your provider approval queue to sign off on faxes, labs, and other documents. This icon will direct you to the practice manager, which has some usefulness when looking at schedules. This icon is for images. For the most part, it's useful for pulling up saved documents, and at the Liberty Clinic we have several orthopedic handouts from the Sports Medicine Advisor organized by body type, so that's how you get to that. The flower is a medication allergies list. This is where you'll get into the patient allergies. This symbol stands for the medications. This is where you'll be able to appreciate the patient's current medications, and then you'll be able to e-prescribe from here as well. The test tubes are for the orders, where you'll be able to place lab orders and appreciate results. The next one is the templates button. This will get you into certain templates that you've identified as custom templates that you want to be able to get into quickly. This button is the Documents tab. It's how to create certain documents, such as lab documents, to send to the patient. This button is Procedures. It's a little bit of a misnomer. It's more of an account of different charges for the patient visits. So you'll see here that there's a list of different charges here. So that's kind of the charge list. And then this is grayed out as the Close Window button. That allows you to close the window you're currently in when it's highlighted like it appears below. If you click on this little down arrow, you'll be able to add or remove buttons. Other buttons include the clear and delete. We recommend not keeping those on your toolbar, so I would uncheck that if they're checked. ICS really has very little use except for medical records, so unless you're on the medical records staff, I would recommend probably taking that off your toolbar. Problem list actually can be useful, but it's really duplicated. When we get to the next bar down, I'll show you that, so we probably don't need that one. Referrals really has no use at this point, so we're keeping that unchecked. And then equipment could be useful if you're looking for EKGs. Currently, that's the only thing we have under equipment, so if you'd like to keep that checked, you can. And the rest of them we have checked. If you'd like to customize the size of your icons, you can go here, and I'll show you that again. So you'll click the down arrow, Add, Remove Buttons, Customize, and you'll be able to change large or small icons, whatever your preference would be. In addition, you can insert separators between these. That'll be these lines like this between your buttons, and then you can move up or down your buttons in whatever order you have for your preference. And it's only for you. It's not for anybody else in the enterprise. All right, next down you'll see the patient toolbar. This will kind of identify the actual chart that you're in. If you're not in a chart, this will not be here, but if you're in a patient chart, you'll see the patient's name up here. If you click on their name, it'll pull up their demographics like this. Next, you'll see their date of birth, weight, and this is the most recent weight documented. If you hover over the numbers by their allergies, it'll show you their allergies. Problems, again, shows you a list of problems. Diagnoses will list any recent diagnoses, most recent on top. Medications will pull out a medication list. This is a toggle for minimizing and maximizing the bar. To the left, you'll see some buttons here. This button is to send a patient email. Create a telephone call, which we'll get into in another episode. Create a to-do, which really isn't used very often in the clinics, but we can go over how to do that in the future possibly. And then to navigate a patient, which is how to change their location within the clinic, which we'll get to in a future video. This right here will display a patient photograph if they have one on chart. The alerts button here is red when there's an alert present, such as, in this case, several. If there's something that's important but doesn't go on the medical record, it's helpful for other clinical staff to know, for instance. This will be checked, and you're more than welcome to add things in here. Next, you'll see the patient's address, contact phone numbers, and if you highlight over it, you'll see several different phone numbers, including an email address. Insurance will be displayed here. If they have a nickname, that'll be there. And then if they're on the patient portal called NextMD, it'll say yes. In this case, the patient isn't. This is their preferred pharmacy. This is who their primary care provider is. If this is a specialty clinic, the referring provider may be listed here, and then the provider for that encounter is listed here. Next, you'll see a patient-specific information window here. This says OB/GYN details. If you click on this, you can insert information regarding the patient's female history. In children, for example, you can have newborn history listed here, so this will kind of be dependent on the patient themselves. PHI log is for listing protected health information for HIPAA. If you click on scheduling and you click on the button here, you'll be able to see the patient's past and future encounters. Sticky note allows you to just type in some comments, and this will stay with the patient chart throughout encounters. It's recommended that if you create a comment here, you document it and then initial it and then date it like that. Referring provider allows you to carbon copy other people to the encounter. This is rarely used. HIPAA has limited functionality, but it has some information, I think, for the office staff. Advanced directives is self-explanatory, and then screening summaries. Well, you'll be documenting tobacco use, alcohol use, mostly social history. So that's the basics of the initial walkthrough to how to use NextGen, or at least how to appreciate the basics of NextGen. In the next video, we'll get into a little bit about tasking and your inbox. So please leave comments below if you have any questions, and stay tuned for the next one.